Okie dokie. So we will go ahead and get started. I'm gonna go ahead and take attendance. Within the next week or so, I should be able to just check you all off if you come in. But especially with the mask, it's taking me about a minute to get all your names, so excuse me. Alrighty, Ashanti. Erin. Some of you I had like in multiple classes last year, so I saw your face a lot on screen. So over there. Sydney. All right. Troy is not here. Julia? Oh, there you go. Autumn. Elijah. Karen. Jalen. Anissa? Which one is it? I'm gonna write out the phonetics for myself. So I hate when people butcher my name, so. Steven. All right, Karen isn't here.
Oh, wait, I'm sorry.
Oh, are you
I'm
serious?
used to people like getting wrong.
Oh, okay. Okay, so Tarek was the one who sits back there then. Okay. I'm also trying to learn like where you sit. Hey, Jordan. All right, Haley. There you go. And Brittany. Hello, Brittany. Anyone I didn't call. I will have my formal attendance sheet soon. I just always wait till the end of that drop to stuff to shuffle. All right, so today we are going to finish what we looked at the other day. So let me go ahead and share screen here. And then we will get into the ethics lecture. And if we don't finish that today, that's okay. Because we'll have a little bit of time on Wednesday. There we go. And on Wednesday, I will also bring up the stats from your little quiz that you took on Friday. So if you haven't had a chance to take it yet, go ahead and take it. Between now and Wednesday, it is available through a link on Blackboard. So, all right, we're going to go over some terms and concepts that we're going to hear over and over and over throughout the semester, just to all get on the same page. So, test is a measurement device or technique. Measurement device or technique used to quantify behavior or help understand and predict behavior. So it's a measurement device or technique used to essentially measure behavior or understand and predict behavior. And a psychological test in particular is designed to measure characteristics of human beings related to behavior. So like a lot of times, if we think about a test, right, it's going to be like, how much did I memorize this? And that's behavior in its own way. But in psychology, we're typically trying to look at characteristics that go larger than that, right? Things like personality, intelligence, things along those lines. So that gets us to this measurable characteristics of human beings related to behavior. And there are different types of behavior. One is overt, O-V-E-R-T, and one is covert, C-O-V-E-R-T. So overt is stuff you can see, it's observable. So I can see that many of you are writing frantically right now. That's overt behavior, right? And then covert is things we can't see. Things like feelings, thoughts, all kinds of things that go on in your mind that there's no direct behavioral manifestation, right? So some of you might be thinking, oh, this is really interesting. Some of you might be thinking, I wish she talked slower. Some of you might be feeling tired. Some of you might be feeling really energized. I can't tell that just by looking at you, right? I have to figure out a different way to ask you about that, to get that information. And that covert behavior is a lot of what we do in psychological adjustment. And it can be really tricky to do well. Alrighty, you're also gonna hear the word scale a lot. And this is not like a fish scale or a scale where you weigh things. This is essentially how we relate raw test scores to some sort of theoretical or empirical distribution. So basically a scale, that's a really wordy way of saying, a scale is how people respond to a test, right? So it might be what's called a Likert scale. You may have seen many of these in your life where it's usually like 1 to 5 or 1 to 7, and it's like absolutely agree, but absolutely disagree, right? Or it might be true false. It might be something where the participant has to produce an answer, right? All of those are scales, but we typically think of scales more as like those Likert type things.
Part of the skill, like how we relate raw test scores to
Theoretical or empirical distribution. So essentially how we relate it to theory. How do we take these raw data from a test we've given someone and relate it to the theory we have about human behavior? Another thing we run into a lot, particularly as we talk about personality testing, is state versus trait. So state is right now, one point in time. So your state's emotions are going to change depending on what's going on, right? So you might feel getting tired now, but later you have more coffee and then you feel energetic, or you feel really annoyed right now for some reason. Maybe you ran into traffic on your way here, and then you got unannoyed, right? A trait is enduring across situations. Enduring across situations. So it doesn't change. It doesn't change. So traits are things like personality traits, right? What happened today isn't going to make you less of a kind person, right? It's not going to change your general intelligence score unless, you know, you suffered a major head trauma or something like that, right? So states are things that change moment to moment. Traits are enduring across situations. And then we can also give individual or group tests, right? So we can bring people in one-on-one, or even in a group setting, we might give people individual tests to complete, right? But sometimes, particularly if we want to look at social behavior, right, we might ask people to engage in a test that involves interacting with each other and observe them. Is anyone here part of the Benton Honors College? Okay, so like when you all come in, they make you do these like activities together, right? And like they're trying to see your leadership abilities by observing that, and that's a group test, right? How are people going to interact? I experienced something very similar. Some of you might, if you are a RA here. When I was an RA, that was part of our assessment. If they're like, design the ideal, you know, residence hall, you have to do it in a group. So they were looking at leadership abilities much. Not really what we're actually about. It's just one person, you're getting one person's information. So it could be bring that one person into your office, or in theory, I could give you all an individual test right now, right? I kind of did that the other day, or you did your individual diagnostic test, right? So in clinical work, we tend to obviously use individual assessments because we're usually looking at an individual, unless we are doing, say, family therapy, right? In which case our client is actually the system between the family members rather than what each individual family member has going on. Some other terms and concepts that we'll run into. Ability, achievement, aptitude, and intelligence. People tend to mix these up a lot. I'm gonna feel my curly head is a little control a little bit. So ability is the broad category that is sort of above the three below it. So ability is like the overarching or umbrella category that includes achievement, aptitude, and intelligence. Achievement is what you previously learned. So most standardized tests that you have to take, like at the end of each year in K-12 would be achievement tests. So achievement is previous learning. Aptitude is your potential. When you're giving an aptitude test, you're trying to look at someone's potential, perhaps to acquire a certain skill. So it's not about what they've already learned, it's what could they do in the future. And obviously that's really hard. Predicting future behavior can be difficult. And then intelligence is the general potential to acquire new knowledge and solve problems. So the general potential to acquire new knowledge and solve problems. So all those we'll talk about, we talk about education-based testing, we'll talk about the GRE, the SAT, all that fun stuff. And then we'll talk about the next one when we talk about personality testing. So there are structured personality assessments or tests, which are based on objective statements that you respond to in a specific way. Maybe with a scale, maybe true, false, that type of thing. Projectives are what we typically think of when we think of assessment. Projectives are the things you see in movies. Things like the Rorschach ink test, right? When we talk about that, I'll try to find the clip. There's a great clip from a movie where, like, while someone is observing a Rorschach, the prisoner is like, "Oh, it's a fluffy bunny rabbit," and things like that. And they ask the observer to leave because he's being distracted. And as soon as they do, they look over like, "What do you see?" And the prisoner says, that's sort of the dramatized. It's very rare you would get something like that. But certainly that's what we think of when we think of assessment. It's like some random thing you hold up and the person has to respond to it. What's that?
Subjective.
Subjective, definitely. Very subjective. And so then the term psychological testing is basically all possible uses, applications, and concepts of psychological and educational tests. So uses, applications, and concepts of psychological tests, but often educational tests get folded in too. For one reason, it's typically psychologists who do or help construct much of the tests that are given. So for example, a friend of mine who is an educational psychologist, so she focuses on the science of learning, she has a grant from the Educational Testing Service, ETS, who owns a lot of the tests, like the SAT, to work with their data, to look at predictions for things and to hopefully construct better tests in the future. So the other reason why your book in particular includes educational as part of that is that your book is actually written by a counseling psychologist, and not all, but a good portion of counseling psychology programs tend to be housed in departments of education at large universities, because typically counselors will end up working in either K-12 schools or higher education. They don't have to. I have a friend who's a counseling psychology PhD who runs a private practice, right? He kind of took it, he entered into partnership with someone who was retiring and kind of bought her out, essentially. But, certainly a lot of counseling psychologists end up in educational systems. Yeah.
Who writes the best books?
In general?
Yeah.
Oh, that's a really good question. And a person that really asks about this, if you have her, is Dr. Margarel, because she writes textbooks. But essentially, it's like Sometimes it's giant experts in the field that they ask to do it. I've been asked to not write textbook, but write supplementary online material for several different textbooks. And it was because they asked me to review a chapter of a textbook and they really liked how detailed my review was. And so I think Dr. Marderall might have started that way too, where she started doing like some supplemental stuff. So one of her child psychology books has these videos of like throughout a child's first years, and it's one of her daughters. So the videos is like her and her daughters, which is really cool. So yeah, sometimes it would be, you know, like there's an interpsych textbook written by Philip Zimbardo, the guy who did the Stanford Prison Experiment, right? So it's like, he's a huge thing, he could just kind of sell that. But sometimes it's just who the publishing companies build relationships with. So it's really sort of interesting. And sometimes you might have an idea, psychologist or, you know, any field, really.
I meant specifically
For psychology, yeah, typically, yeah, it's like who builds the relationship, or if you as a psychologist have an idea for a textbook, you think there's not one out there that's doing what you want it to do, you can write a proposal and sort of shop it around to different publishers, just like you would like a novel, for example. But yeah, so it's not as like, oh, I know the person who should write the textbook as you think, right? Yeah, sometimes it is someone who just like has a good relationship with the publisher. Sometimes it's someone who like just has a really good idea for a textbook. And then, you know, it's who's willing to keep going with it too.
Yeah, I know it's given with it too.
Yeah, because like, for example, some of you took Psych in the Law with me last semester. My Psych in the Law textbook is now written by a different author just because like the first author passed away, but the textbook sold well, so they kind of like gave it to somebody else. And I think Dr. Margot, one of her textbooks was like that, where the person retired, and so originally she was second author, and now she's like first author. So, yeah, really good question. It is sort of a interesting process. Academic publishing in general is weird, to be honest. So like for journal articles, you submit it to a journal, and then like it's peer reviewed by people, and then hopefully you get good feedback and you can revise and publish it. But you don't get paid for your publication. The people who are reviewing you don't get paid. Like it's all kind of a racket, honestly. But we do it because you know, we want to advance science. But yeah, really good question. Other interesting thing about you know, publishing it related to assessment is a lot of times the person who comes up with the assessment doesn't make any money off of it either. Some do, but some do not. So for example, one of my grad school professors, Jack Graham, worked on the MMPI 2, we're now on the MMPI 3, but he didn't get any money when people like bought copies of the MMPI. But he wrote a separate book about the MMPI and he would make money off that. There are other tests where the person like kind of writes it in their contract, they will get the money, or they self-publish it and get the money. And there are a lot of assessments, especially shorter assessments, that people just publish so that anyone can use them, and make them freely available. So yeah, just sort of an interesting thing here. All right, so I know some of you, I think, have taken my ethics and professional issues class, so this will be a little bit of review. But even for those folks and for y'all, there are really specific ethics when we get to assessment. And so that's why we cover them really specifically here, but also early on in the semester. I think it's really important to kind of recognize what are the parameters under which we can give assessments ethically, and when are we out of line? That's really important. Let me turn the captions back on here. There we go. That'll help. Alrighty, so in the back of your textbook, there are copies of the ethics codes for both the American Counseling Association and the American Psychological Association. And if you flip through those, you'll see that a lot of the stuff overlaps, right? Some of it's just sort of like, you would hope common sense, but some of it's just good practice, right? So we're going to talk about each of these things in more general and kind of refer to different aspects of these codes and how they apply to actually doing assessments. So no need to scribble all these down. Each of them will get their own slide as we go through. All right, so one of the things that we look at is test worthiness. And this doesn't mean is the test itself worthy. This essentially means, well, there is that, but it's basically, it's not like Thor's hammer or King Arthur's sword, type of worthy. It's basically a lot of what we'll talk about in the forthcoming chapters in terms of reliability and validity, but also cross-cultural fairness. This is a big issue in psychology that hasn't been addressed until recently, unfortunately, in many cases, which is that most of the assessments we give were normed on white, typically college students, right? And they tend to be straight and cisgender and heterosexual, people who were born in America, so we're not accounting for the immigrant experience. And so we need to take into account cross-cultural fairness as well. Also, practicality, right? If an assessment to answer a one-sentence question takes 8 hours to give, probably not a good use of your time or your client's time, right? But if you can give something in about 5 minutes, probably more likely, right? So we have to kind of balance all those. And one of the things we talk about is participant burden, right? So like, how much are we going to exhaust the person engaging in the assessment process? And obviously we don't want to do too much of that if we want to get accurate scores. So competence is one thing we look at as well. There are levels A, B, and C competence. And these are how we classify assessment instruments. So level A is anyone can score them, anyone can administer them, anyone can interpret them. As long as you've read the manual and basically understand why this assessment exists. So a good example of this is those educational achievement tests. So those tests you would take at the end of the year in K-12, things like the SAT, right? The people who do that don't have to do a whole bunch of training. They basically like get a sheet and read it, right? That's a level A. A level B requires more technical knowledge. So you have to understand test construction, but also its use. And typically also to give a level B test, you're expected to have some graduate coursework in psychology, typically in assessment. So a class like this at the graduate level, but also sometimes statistics as well. So in terms of calculating scores, things along those lines. So those are things that grad students or someone with a master's level degree would be able to administer. Level C requires an advanced degree in psychology, so something like a PhD. You could also have an EdD or a PsyD, but essentially a doctorate degree, and or licensure as a psychologist. But you also need training in that particular test. So hopefully, I haven't actually checked this link. Hopefully this website is still live. Hey, it is, all right. So this is actually from Pearson, who sells a lot of the tests that are used in clinical settings. And they actually have this on their website in terms of like, okay, if you want to buy an A-level product, what are those? If you want to buy a C-level product, what are those, right? These are the more careful things you have to get. Now, I was really kind of surprised when I got here and I started teaching this class. I bought a bunch of assessment materials that I'll bring in throughout the semester to show you. I have my PhD, but I'm not licensed. And I contacted these companies and I was like, can I do this? Like, can I buy these? And they were like, yeah, you have a PhD. And like, they didn't really ask me to send proof of it, like, they just kind of trust me. I guess they're hoping people who are PhDs are ethical, right? But it was really weird to me that it was just sort of like, sure, yeah, go ahead. So very different than I expected. I really did expect that they would be much more concerned. Yeah.
Does a licensed clinical social worker fall into that?
That's a really good question. Yes, so they would, if you're a licensed clinical social worker or a licensed professional counselor, LPC or LCSW, typically, yes, as long as you have training in those particular tests, you would be able to purchase and administer them. The other thing I should say too, is if you are in training and supervised by someone with that degree and with that experience, you can administer it. Again, as long as someone who's supervising you. So we actually gave a lot of assessments at Kent State because we were sort of an assessment school. And when we wrote our assessment reports, it wasn't our therapy supervisor who supervised us on that. It was actually a specific psychologist who was a specialist in assessment who would supervise us on writing up those reports. Not that our therapy professors weren't qualified, it was just like, we have these experts, why would we not use them, basically. All right, and then confidentiality becomes a big issue. So anytime you are interacting with someone as a client, right, you need to understand confidentiality and also discuss it with them. So their confidentiality, if you don't know that term, is essentially the right and agreement between the assessor or therapist and the client to say, what we talk about in here will be completely private between the two of us unless you give me permission to share it elsewhere. So for example, you might do an assessment pre-surgically for someone and they'll sign a release so that you can send it to their surgeon. Or you might do an assessment for someone for court, right? And if they hire you, they sign a release. If the court hires you, they don't have to sign a release. The court is your client at that point, not the person in front of you. But even if they are a private therapy client coming to you for this assessment, there are times you not only can, but should break confidentiality. The major one is being a risk to themselves or other people. So this would be risk of self-harm, risk of death by suicide, a risk of homicidal intent, right? Expressing aggression towards a specific person, right? So I was doing an assessment on the spinal cord injury unit while I was on my residency. And there was a guy who claimed he had a gun. I brought it into the VA and that he was going to kill his roommate because, in his words, she just needs killing. Which, like, in retrospect, I could kind of laugh at, but at the time was terrifying, right? And so I had to like call in my supervisors, make sure everything was okay. And it turned out this was just a guy who did this to trainees to see how they'd react, which is sort of shits and giggles, I guess. But you know, you have to take it seriously. We not only have a right to, but we have a legal obligation set down in the American court system to warn someone if we know of a specific threat to their life by our client. Another time you might break confidentiality is if you're assessing a child. The parents have the right to the information if they're under 18, right? Unless a different type is done there. Again, there are times the client will ask you to break confidentiality, you know, send this to my doctor, share this with my school, things along those lines. Again, I mentioned if you're bound by law, so if you are hired by the court system, you have to explain to that person from the get-go, everything we talk about here will go to a report that goes to the judge, right? You are not my client, they are. The other reason is supervision. So when you are a trainee, you have supervision every week on your clients. And again, you might have separate supervision for assessment. And you are not technically breaking confidentiality because you're in a web of confidentiality with your supervisor, but you certainly tell your supervisor everything about your client in a way you would never tell anybody else. if that makes sense. Because they are ultimately responsible for that client's welfare, and you technically as a supervisee are practicing under their lives, under their license. So if you were to get sued, it would kind of like fall under that. They need to know what's going on. Plus, especially when you're really new, it's really helpful to have a supervisor every step of the way explaining things. And sometimes even when you're not really new, weird stuff happens. Like I had a client who, her MMPI was perfectly normal, but like her first therapy session, she screamed at me, and like refused the treatment. Like, it was just like to the point that when I left the session, I got her calmed down, we came to an agreement. People in the clinic were like, "Are you okay?" We used like noise canceling machines, like you usually couldn't hear what other people were saying, right? So I brought her MMPI in and I told this story to Jack Graham, one of the authors of the MMPI, and he was like, "I literally see nothing on this that would have given me any indication she would act like that. Like, you know, some people are good at hiding it, and sometimes there's just stuff that doesn't detect, right? So you can get some really good guidance from people for that. And again, release of information or this written agreement. The other thing I should say about the client asking you to break confidentiality is sometimes they will bring in family members, spouses, things like that for the assessment feedback. And they'll say, you know, I want them to know the results too. And that's fine, as long as, again, they're giving you express permission. So. Already, some other things we need to be aware of in terms of ethical issues, cross-cultural sensitivity, I already hinted at. You have to know the potential biases of these instruments. You know, if something was created only on, you know, white people from New York, right, you need to think really carefully if you're giving it to anyone else from anywhere else, right? You know, and what is the potential harm of that, right? If you are interpreting someone's data based on data that's not representative of them, right? What faulty conclusions could you draw that might negatively affect their life? So you need to be careful when you select the instrument, when you administer it, right? So when you're in that room with that person, you have to be aware of your own cultural biases, right? And hopefully eliminate them, but also when you interpret the results. For any assessment, you need to obtain informed consent. So those of you who have been at Wesleyan for a while may have participated in some of our research studies, and so you're familiar with what an informed consent form looks like. Typically, you see this on like the first screen if you're doing it online before you click in, right? And so you basically have to inform the person of what you're going to do, why you're doing it, and what will happen with that information afterwards. And also part of that should be letting them know when you would break confidentiality and that type of thing, providing them with resources if, say, something distresses them. Invasion of privacy, pretty much every assessment does this in some way, right? And so you minimize the problematic aspect of this by that informed consent process, right? By sort of informing the person what's going to happen, agreeing to things, that sort of minimizes the bad parts of it. If you are doing an assessment that results in a diagnosis, you need to be very careful with making sure your diagnosis is accurate, right? And then also to think about all the repercussions of that diagnosis. So things like, how's that person going to react when you give them that diagnosis? Let's say someone comes to you for an ADHD evaluation and you discover they don't have ADHD, but they've been getting accommodations their whole life, right? What repercussions is that going to have? Now, if you find out something else is going on, maybe in fact, instead of ADHD, they have test anxiety, right? You can give similar accommodations to ADHD. You just need to make sure you're outlining that carefully. Another example is, let's say someone does an assessment, maybe even they're slightly knowledgeable about psychology, and then you give them a diagnosis that has a lot of stigma attached to it. So I had a client who was a master's student in psychology, I took some counseling, and we did assessments, because she's like, I really want to know what's going on. And it turned out she had a personality disorder. And like, she knew what that meant, that those are underlying, they're very stigmatized, and she freaked out the most I'd ever seen her freak out in my office. And so I spent a half hour with her, just sort of walking her through, like, this does not end your world, right? And it's okay, and, we can work on things and behaviors that will help with this, and skills, but yeah, I mean, even though I was very careful in how I framed that, because I knew she might react this way, right? It can have major implications. You diagnose someone with schizophrenia, right? Hugely stigmatizing. You want to make sure you get that right. Yeah. Oh, yeah. The medications for some of these things work really well, but have horrible side effects. And if you don't have it, can have even worse side effects, right? Exactly. Well, and then the other thing too is, let's say we're giving someone a medication they don't need, that can have all kinds of unintended, or we're giving them too much of a dose. Again, as a psychologist, we typically wouldn't be prescribing, but we can be sort of consulting on that. I had friends in undergrad. My undergrad, I think I mentioned to you all, was like in the middle of cornfields in Ohio. We had one college physician, and so we didn't have a psychiatrist. And so if you needed medication for anything, he prescribed it. And I had two friends who were depressed, who the overprescribed their antidepressants, and he actually flipped them manic. Like, to the point that one of my good friends, we were sitting at dinner, and she just like looked out the window and she was like, animals. There were no animals. Like, it was just like, are you okay? Right? Yeah.
So, what about people that are coming off of drug abuse, but still need to be prescribed something? How does that work?
That's a really good question. Yeah, so doctors in those situations are very careful about, what they're prescribing, what its addictive properties might be. For example, let's say they're coming off of alcohol abuse, but they have recently had surgery, right? They probably do need pain pills, but then we know they have this addictive quality to their past behavior. So good pain clinics do things like have you stop by and do a pill test. Or things like one of the psychiatry residents I worked with was like, my client is out of their medication 2 weeks early. So either they're overtaking it or they're selling it, right? And so you have to kind of monitor that stuff. And again, as a psychologist, you might not be prescribing, but you can still kind of ask about these things. And sometimes with people who have things like schizophrenia or bipolar disorder, a lot of your job might be helping manage the medication. How do you remember to take it? Someone who's bipolar, when they get panic, they don't feel like they need that medication anymore. They feel great, right? Even though they might be a danger to themselves or other people. So like working with them on how are we going to keep you taking your meds even when you start to feel this way? We really talk. Yeah, good question. And I'm not ever speaking against these types of medications if they're used properly, right? But you just have to be careful with them. And some of them, yeah, can have horrible side effects. Some of them can be lethal if they're in the wrong doses. Marshall Linehan, who's one of the most influential therapists, researchers around personality disorders, parasuicidal behavior, she has a slogan which is no lethal drugs for lethal patients. So she doesn't believe that patients who have suicidal ideation should be given things they can overdose on. There are other classes of medication, for example, for depression, that you can give, and don't do that. So it's about having that release of information so you can talk to the psychiatrist, collaborate. Sometimes psychiatrists and psychologists will be in the same offices so that they can coordinate patient care. It becomes really important.
I think we're still trying to. Year, they were trying to go stop the pill farms down south. I mean, it's a problem.
Yeah, they're another good HBO documentary. I talked about watching documentaries in my first class this morning, but they put out a documentary about the opioid crisis and like again, the unethical things that happened there, like there was like one Walgreens in Florida that like, they would just pass them out, didn't kind of matter. But they would stop at 2, so their actual patients could get medication, right? Like they knew. Yeah, very problematic and really detrimental to a lot of people's lives. So this is a really important part of ethical things as well as making sure that person gets the correct care, not just throwing things at them, whether it's therapy or medication. Release of test data. So you should only release it to the individuals who have the right to the data and won't misuse it. So again, doctors, school administrations, or things like IEPs. Another important part here, which is kind of feeding down into test security, is the integrity of the test content itself. I mean, these tests are copywritten, but also if like the items for the test were just out there, right? Anyone else who went to take it could like essentially cheat, if we were going to go cheating on the psychological inventory, but like either look better or worse than they actually were. And so it's part of the ethics of assessment to not give things like the test items to people who are not at the level C or whatever. But you give them a report based on their findings, and that's really what they need. They don't need the raw scores, even though some people will try to tell you they don't. Test administration. So a lot of the tests we'll talk about have carefully standardized instructions. You've got to give it that way. If you deviate from that, it invalidates the test. It can give you inaccurate results. And let's say it were to go to court, it won't hold up. So for example, another of my professors, Josie Ventura, was called as an expert witness in a personality test case where the person doing the assessment just read the items to the person because they had lower levels of literacy. Well, that sounds great and accommodating, but when you read something, you can put things into it, right? So I could say, keep the integrity of the test content, or keep the integrity of the test content, right? And you can't tell because you don't have a recording of it, right? So there are actually standardized, like pre-recorded, neutral voiced, at that time, audio tapes. I'm guessing they're just MP3s or something, right? That you can use, and this person did. So essentially, UMC testified in court that the results were invalidated because they didn't do that. So it's a great story too. He showed us a picture that the court sketch artist had done of him because the lawyer was trying to like establish him as this expert witness. So he kept pulling out like all these books and journal articles. Did you write this? Right? And so the court sketch artist gave him a picture afterwards of him just like surrounded. So that was great, but there was a little bit of a sense of humor at least. And then test scoring and interpretation. You need to understand how to do that correctly, right? But then also understand the limitations, right? It can only tell you so much. And you also need to look at things like, you know, any interview you did with that person, their behavior while you interacted with them. How did those things come into play? So how do we make ethical decisions? One of the models is called the moral model. And this comes from Remley, and I'm not going to butcher the second person's name. And they talk about autonomy, that this is autonomy for the client. We want to respect the client's freedom of choice. If that client is not court ordered and halfway through the assessment, they're just like, I don't want to do it anymore. They don't have to keep doing it, right? You know, they don't want the information anymore, fine. Beneficence is promoting well-being, right? So as you're engaging in any ethical decision making, but certainly in assessment, you want to make sure you're doing it in a way that makes it as enjoyable, you know, unstressful as possible for the person. And then that relates to non-maleficence, which is essentially do no harm. Right, so you want to avoid purposely engaging in harmful behavior, whether that's giving an assessment incorrectly, whether that's like skipping over something because you're tired, right? Whether, it's like an abrasive interaction with that client, so they're not in the right headspace to take the assessment, right? You have to kind of be aware of all the elements of setting up a good testing environment, right? Not having construction right out your window if they're having to do things that require timing and concentration, things along those lines. Oh, no, non-malfeasance is just do no harm, basically, yeah. And then, beneficence is promoting well-being. Justice or fairness, just treating everybody equally or with equity, sometimes more important. Fidelity, a term that really means loyalty. So being loyal and faithful to your commitment ethically, your commitments to the client, right? And then veracity is just being honest. Don't make stuff up. Don't exaggerate the findings because you think it would sound cooler, right? Just be accurate. Sometimes you do a whole assessment and you don't really find anything. And you know what? That's okay. That person probably is just having what psychologist Thomas Zaz described as problems in living, right? Just stuff that's going on in their life. Yeah. Which one?
Autonomy.
Oh, autonomy is the client's ability to choose. Yeah. So if they want to stop, they can stop. This happens in research. So technically, any research study you start, if it's online and you just can't finish it, you can just click out of it, right? Even if you come in person, you decide you don't want to participate anymore, you can walk out the door, and that's fine. Oh, it's okay. Sure. So, justice or fairness, pretty self-explanatory. Fidelity is loyalty to your duty and your client. And then veracity is just being truthful. And so this is another way of making ethical decisions. This is a problem-solving model. So you want to identify the problem that exists, if it's an ethical dilemma of some way. What are the potential issues involved? Go back to your ethics code and review the relevant guidelines. It's easily available online, right? People will often have printed copies available in their offices. You have to know your laws and regulations of your area. Those might differ from state to state, from city to city. And this is why we don't have universal licensure in the US, because each state has different procedures. So you have to get licensed in each state you go to, essentially. So like, were I licensed here and I decided to move to Ohio, I'd have to go through at least some procedure to get relicensed there. There are a couple exceptions to that, but essentially it's because part of the licensure exam for each state is knowing about their laws as pertains to your practice. Obtain consultation, so talk to another psychologist, talk to an ethics or an assessment expert if you're confused. We had a case when I was in grad school. A woman the year above me was having a real ethical issue with one of her clients. And so they actually called the head of the APA's ethics office, and he did a phone consultation with them. There are resources out there. Consider possible courses of action. What can I do, right, to make this right? And what are the consequences of each of those courses of action? And then make that course of action, decide that course of action. All right, we'll have just a few more slides to go over on Wednesday, and then we'll spend some time Wednesday going over the concept in general for the group project, but then also how to do an IRP, which will be a big part of the initial steps of your group project. And also, if you're doing assessment for research purposes, really important step in the process. So, alrighty, thanks everybody for being here and being engaged, and I will see everybody Wednesday if I don't see you tomorrow in class.